and also the director of our food certification. So welcome, Dr. Taschner.
Thanks, Mike. Nice to be with you. From
Yeah,
a socially appropriate, socially distant agreement.
Yeah, that's right. That's exactly correct. Social distance, I like to call it, I can't even remember my term I came up with. Proximity optimization. That's it. Proximity optimization, because
absolutely.
I want us to be social. So I don't want people to feel like they can't be social, because I think that's important to everyone's lives. So anyway, that's what I call proximity optimization. But either way, it's the same concept. And yeah, we get to do this over video chat because of what's going on. But this should be some good information for people out there, because you are a practicing physician. And I believe you're in cardiology. Is that correct?
That's correct. Yep.
All right. So why don't you let people know, because of what's been happening with COVID-19 coronavirus, what have you noticed? What changes have you noticed in just seeing patients? How has that changed over the last few weeks?
Well, I think that people in general, both on the physician side and the patient side, have become, in a sense, more fearful, but also more cautious. So we are having people that are canceling appointments. We have more no-shows, more people calling ahead of time to cancel. For patients that do show up, we're really trying to limit it to people that really need to be seen now. So people that have just kind of regular follow-up appointments, we're trying to either move them to a different time or move them to a telehealth appointment, which I'll talk about. For the patients that actually do show up here, we're always very cautious about sanitizing our hands and trying to keep the areas clean, but we're taking that an extra step. So all of us are scrubbing for the 20-30 seconds with we got an industrial strength antibacterial. So I personally am going in and wiping down my rooms in the morning and the afternoon. My medical assistant's doing that, wiping down my stethoscope between every patient, wiping down my counters, my computers, washing my hands before I eat, but trying not to touch my face. So doing all those things that they're recommending, so we as healthcare providers can stay healthy too, not spread this to our patients, and so we can continue to see patients and keep them healthy. As far as the telemedicine, though, you mentioned, so we're just rolling that out. Actually, we had a webinar on it last night and this afternoon, so I'm going to be seeing my first telemedicine patient tomorrow morning. So for these kind of regular follow-ups, patients that aren't overly complex, that's a good option. For newer patients or patients that really need to have a thorough physical exam, may not be ideal. But for other patients, if we can keep anyone out of here and still give them appropriate medical care, I think it's a great option.
Okay. Do you think that that's something that will just be around during this time until the virus has been, I'm not saying being cured, but until we get through this period of time? Or do you think this is something that maybe the industry will move into more into the future?
Yeah, well, so as far as like I'm assuming you're talking about the telemedicine part.
Telemedicine, yes.
I think as far as the sanitizing part, yeah, that kind of might change how we do things moving forward too, though, because I think we're all much more aware. Like this is kind of a new normal for us, and it may become the new normal out of necessity. So I think it's given us all a better appreciation for even things like touching our face, right? So and how easily things may be present that we're not even aware of there on our clothes, on the countertops, on the stethoscope. So that's on one hand. As far as the telemedicine goes, yeah, I think whether or not this coronavirus was present or any other infectious disease issue, I think that medicine is moving to include more telehealth. I don't know if that it will ever be replaced completely, because there is something to be said for a face-to-face visit and touching a patient and physical exam, but just for convenience and for this virus in particular, for safety as well. My group is going to be rolling this out anyway. This just necessitated that we did it a little bit sooner.
Sped it up, yeah.
And I also do some nutritional counseling where I've been using telehealth, just because patients or clients, that's oftentimes more convenient for them to be doing it from home and off hours or weekend visits when maybe the office isn't open.
Right. Okay. And a lot of things, like you said, don't require that in-person visit. So it seems to be much more efficient. And I think the technology is so much better than it used to be. Maybe people aren't familiar with how good. We're doing that right now, right? We're having a little tele meeting here, and the technology is very good. So it's not
And
what
they
it
have,
used to be.
yeah, they have very easy platforms that are patient friendly. So some of them have apps or just links that you click on and it opens, it opens the camera up for both parties. We can document right through the platform that's open. So although it sounds complex, particularly for some of our patients that are a bit older, most of them I think are going to find that's pretty easy.
Right. I have a curious question. What about like the HIPAA and privacy things? I mean, do you have any kind of stipulations around where someone can have a meeting? Like if they're out in a restaurant talking and other people can hear them, is that
Right.
not allowed? I'm just curious. I mean, obviously we can't go to restaurants right now, but I'm just talking
Right.
about the future. You know,
Yeah. So most of these are HIPAA compliant. I mean, if they choose to be in a public space, that's just like if they chose to bring people in the room with them. We really have to be HIPAA compliant on our end, though. So we need to
all
be
right.
doing it in private space.
Okay. Okay. That's interesting. And going back to washing your hands, like you were mentioning,
Uh-huh.
can you describe to us the proper way that is done? Because I've seen so many things in the media that say like only 5% of people wash their hands correctly. And I don't know how much of a percentage is that of people that actually wash their hands or people that just don't wash them at all. But it sounds like
Right.
people are doing it wrong. So what is the correct way to do that?
Yes, I guess, to kill all of the bacteria and reach all the nooks and crannies in between your fingers, they're saying to do about 20 seconds, or they sing happy birthday or your ABCDs.
Yeah.
I think typically for me, I mean, I'm probably guilty as the next person, right? To go in and I do a quick scrub, 5 seconds, maybe 10 seconds. I maybe not get all the nooks and crannies as well as they should, so I'm making an extra
Right.
effort to kind of cleanse each finger, between each finger, really, just really so nothing's surviving as much. You
Right.
question whether or not that's good for your microbiome long term, but I think in the
Sure.
short term, and I'm being serious when I say that,
Yeah.
there's concerns about sometimes using too much of these antibacterials and
Yes.
killing your good bacteria. But I
Yes.
think in the short term, in the interest of preventing communicable disease, that's the important way to do it.
Yeah, I've heard that because I've done a little research of my own about how to keep up your immune system or optimize your immune system. And some of the things I've found say don't use hand sanitizer because it messes with your immune system.
Right.
But like you said, in the short term, we need to do that. And
Correct.
there's a shortage of hand sanitizer because everyone's trying to get that done right now.
Yeah. It's kind of like when you get antibiotics, like, I try to avoid antibiotics, but they do have their
Right.
place, right? If you have a bad pneumonia and you're in the hospital, even though this is maybe knocking out your gut microbiome, it's a risk versus benefit. And in that situation, the short term, the benefit outweighs the risk.
Yeah.
And that's the same thing here. It may not be ideal. I mean, your skin's your largest organ. We're absorbing everything we're putting on our skin.
Right.
These may suppress some of your natural microbiome. But in the short term, I think it's important not only for an individual safety, but for public safety.
Yeah, I guess it's the same reason why people are saying, shelter in place and quarantine yourselves, self-quarantine for the same type
Correct.
of reasons. Well, I have another question about hand washing because I was thinking about this today. What about the length of your fingernails and things getting underneath that? Is that a concern? How does that?
Yeah. I don't know with this virus in particular, but I think most of where it's going to spread are the surfaces that we touch. But yes, fingernails in general are felt to be a pretty dirty area underneath the fingernails.
Right.
And I could show you mine here. They're trying to keep them nice and short.
Right.
But no, that's, I think, they've always said, like, don't bite your fingernails. There's just stuff that can build up under there.
Mhm.
So I don't know if that's as much of an issue for the virus because we're not necessarily contacting the virus with that area.
Right.
So I'm really trying, basically this thing can be transmitted to wherever you're touching it. And sure, if you don't wash your hands at all, I guess it can make its way there. But I would think that the areas that you're directly contacting it are the areas at greatest risk.
Okay, that makes sense. Yeah. So as long as you're just doing the most complete job you can, I guess I was kind of wondering if women tend to have longer fingernails than men, if women should keep them clipped short during this time. I haven't heard anybody say that.
Yeah.
So,
my guess is it's not as big of an issue as just making sure your hands are clean. And to be honest with you, I doubt, maybe there's a study done on that. You have to ask them infectious disease specialists. But my guess is that it is probably not that much different as long as they're also washing their hands well.
Okay. All right. Well, that's interesting. So I guess going forward, we're not sure how this will impact just medicine and office visits in general, but I guess we'll see. I mean, I have a feeling this may provide the little push into more technology usage, like video chats and things that we're doing. But I guess only time will tell on that, because you don't have any determination one way or the other where you are, or have they already said that in the future they're going to be doing this more?
Yeah, no, they have. And I mean, I think that we've seen, there's already a shortage of access for a lot of urgent care, primary care visits. So, with some insurance companies in some states where that's really a problem, they've already, I don't want to say mandated that, but they've really encouraged that. Like, if you want to be seen, even with our own health insurance,
okay,
my employees, a number of them have used this service where I think it's like $30 or $40. So you call them, I have a sore throat, I have a cough. You could talk to a physician online. It's much easier than actually going to an urgent care, getting into your primary care physician.
Right.
So I think it's already starting to the momentum forward.
Okay, so this is just going to give it a lot more momentum, I suppose, at this point in time. And then it does sound like, if you've got an illness that is potentially communicable, that it would be to everyone's benefit to do a telemeeting rather than going to a place where others are congregating and potentially infecting them as well. So
Right. And I think, I'm not really familiar with the billing end of the telemedicine. I think they were trying in many instances to make it comparable to an office visit. From my understanding, they're trying to make that process even easier right now. So it's just, they're not going to give you a hard time about billing for telemedicine. They realize this is one of the things that needs to be done.
Yes, in emergency situation, there's so many things that are happening right now that are not normal, right? That people are willing to accept because we just have to at this point in time.
Correct.
Okay, well, I'm glad to hear that the industry has made a lot of changes, which I had assumed they were being made, but I didn't know until we're talking right now. So that's good. And another thing, we have a few more minutes. You are board certified in lifestyle medicine. So can you let folks know what that is and the general concepts behind lifestyle medicine? Because through our nonprofit, we're definitely concerned about human health. And how does all this relate?
Yes, I mean, lifestyle medicine is really it's a means of educating patients how to become healthier through lifestyle changes. So that's one of the things that's oftentimes ignored in a traditional allopathic medical practice. It's not reimbursed well. The quality guidelines really don't focus on lifestyle changes as much as they do on specific measurable parameters, like with vital signs or weight, or if someone's on a specific medicine or what their lab is. So oftentimes it unfortunately gets ignored. In addition, lifestyle changes, they take a while to reinforce and to change, right? To stop smoking, to change your diet. So many times office visits are maybe once a year, or twice a year, or even every 3 months, which may be a more frequent visit. It's really hard to make meaningful change seeing someone that infrequently.
Right.
But the things that we talk about as far as lifestyle medicine goes really includes pillars of nutrition, with really a focus on plant-based nutrition, physical activity, stress reduction, healthy sleep habits, trying to minimize toxic substances like tobacco, alcohol, illicit drugs. And we talk about, again, mental health, meaning like things like depression, anxiety. So it's really focusing, when I think of the major pillars, it's the nutrition, the physical activity, the sleep, and the stress reduction. Those are really the major components. So it's basically about talking to people about these things. And there's lots of individual data with each of these categories, which show that there's benefits pretty much uniformly that help all of our chronic illnesses, mainly things, coronary disease, hypertension, diabetes, cancer, these things that are so prevalent in our society.
Right. And some of the things, really all these things that you mentioned, through my own research, not being a medical doctor, it sounds like things that benefit the immune system as well, the way you describe it.
Right. So, there's definitely, and we spoke a little bit before, there's terms of like the immunity, that part I think has been looked at more in the setting of cancer than infectious disease, but basically enhancing your body's ability to kill foreign invaders, which may be cancer cells, maybe infection.
Right.
Sleep is vitally important in making sure your body gets restored, that it has a chance to clean out all the junk there. So nutrition and sleep, and yes, just making your body a more anti-inflammatory milieu by enacting all of these things, even including things like minimizing alcohol, minimizing tobacco. It's not,
Right.
I shouldn't even say minimizing, not using tobacco. Make sure you have healthy lungs. I mean, this
Yeah.
virus it attacks the lungs. So if your lungs are not healthy, that's a problem.
Yeah.
So yeah, it's all these things, and that's part of the immune system as well. I mean, you weaken your lungs with tobacco, you impair your abilities lungs to clear these invaders that make their way down there. So yes, I think that there are a lot of these lifestyle, the different lifestyle measures can certainly improve the immunity, and there are definitely smaller studies on specific foods looking at their antioxidants and their phytochemicals that are felt to boost this further.
Some are better than others, what you're saying?
Yeah, and they talk about, I was having a conversation with my father this morning. We listened to one of Dr. Joel Kahn's podcasts, and he talked about
Right.
like the magic of mushrooms and their ability. And then there's things like zinc and elderberry, other things that have been more homeopathic, if you will, that have been felt to boost immunity, prevent infection.
Okay, that's great. And how about what you've seen in your own practice of medicine as a cardiologist? How does lifestyle relate to things that you can see, improvements that you can see from your circulatory system in the cardiology world?
Yeah, I mean, so the cardiovascular disease is still the number one killer, and stroke is up there, high blood pressure, diabetes. These are all in the top 10 list of
Right.
killers in the US. And they're all, basically all of my patients, or many of my patients, have most of these problems where they have, because they all tend to cluster. Obesity brings on diabetes, high cholesterol, hypertension, which is associated with strokes and cardiovascular disease. So yeah, for patients that we're able to influence and can really make meaningful changes, they can really have a significant effect. I mean, there's studies which show that we're able to reverse and certainly halt coronary disease. We can dramatically improve cholesterol. People that focus on more plant-based diet tend to be the leanest in population studies. They tend to have the lowest level of diabetes. They can significantly improve blood pressure. And there are studies, again, which focus on each of these things, which show that we can improve diabetes, cholesterol, coronary disease, strokes, just individual studies that look at those endpoints. So, the data is there. It's really getting people to be able to make changes. I mean, these are ingrained habits that people have lived with for many years.
So you must see this, though. If you've got an open-minded patient who is willing to let you, I suppose, mold their habits and change their habits, you see this improvement, right, in your office?
Absolutely. And it's always surprising to me because some people are I would think all of my patients would be motivated after, having had a bypass surgery, for instance.
Yeah. Well,
It's a very small percentage still. Basically, a lot of people think they've been fixed. They can go back to living, how they're kind of this toxic lifestyle and be fine. Some people would, they say they would rather live their normal lifestyle. Whatever happens to them, happens to them. But I love seeing the patients that really take their future and their health into their own hands because they do amazingly well. They're the people that feel the best. They're on the fewest medications. So no, it's definitely something that's doable, and it takes, it takes persistence and motivation to do that.
Right. And habits are the hardest thing to break. I don't care what kind of habit it is. If you've been doing it most of your life, and I'm guessing you're seeing older patients in general, right? So they've had a lifetime of these habits.
Correct. And I'm surprised still that some of my patients that have made the greatest changes are older patients. And then, and the younger ones, I think, knowing that they have more potential years ahead of them, oftentimes are motivated as well. And some of it's just about teaching them, even if they're motivated, teaching them the right things to do, the science, and then how to go about it, implementing these things.
Okay. Well, I'm very hopeful to hear that you're seeing improvement on people that are willing to consider this. And I do know that the way, at least correct me if I'm wrong, but the way the system is set up right now, there's not an amazing amount of incentive to change these habits on the end of the patient, right? You said a patient can just say, oh, well, I don't feel like changing them, right? And that's totally acceptable, correct?
Because if you say, well, they're not going to change, but I'm going to, maximize their statin medicine, their blood pressure medicine, and on paper, yeah, their blood pressure looks great. Their cholesterol looks great. Their diabetes is great. They're on 3 or 4 different medications. Well, yeah. So on paper, that's what's reimbursed. Is there, do we meet these goals?
Right.
Now, ultimately, I think that the lifestyle, when we have someone that's overall healthier, they're going to have less of these conditions to begin with, and we're going to be able to manage them, have them feel better without even being on all these medicines. So
yes, I would love, as someone I consider to be a healthy person, I'm not perfect, but I always seem to have a mind for learning new things and incorporating better habits over time. And it does take me a long time to change certain habits. I will agree. I mean, habits are just so hard to change, but I would love to see maybe a system that rewards that type of behavior, you know what I'm saying, on the patient end, because we have to pay costs, for our own health insurance. In the future, all things can be improved. That's just a way I can see that the system could be improved going forward. I don't know how to do that exactly, but I would love to see it.
Yeah, and I think like the people like Dr. Ornish, for instance, or Pritikin, they were people who were pioneers in this field, but it took them many years to get their program to have enough evidence to show Medicare and insurance companies that there's a benefit. So they were ones that actually did get these approved by insurance. But you're right. I mean, it's the problem is we have to follow these benefits out for many years to determine some of the benefits. We don't know if it's going to improve their coronary outcomes until we follow these patients for 20 years and they've been compliant with their lifestyle changes. I mean, we know it happens, but to prove it to the point where an insurance company is happy or the government's happy, it's a different stories.
Yep. And I know that you are opening your own lifestyle center, right? You're in the process of doing that. So you'll be able to show that just through, I mean, that's going to focus specifically on habits and lifestyle, right?
Correct. So yeah, one of my frustrations, as I mentioned here, is as much as I like to teach, I don't really get to see the patient back for months later, and we don't get to reinforce, these positive principles every week. So my goal there is to bring them back every week and sit down for 30 minutes and say, well, what were you able to accomplish? What are things that we can work on this next week? What was difficult for you? And what can we work on together? We have a gym in there, so we can send them right down the hall and work out with a trainer 2 or 3 times a week. So we know they're doing the exercise. They're going to get homework from the trainer. And then we have a big demo kitchen, so we can actually do cooking classes, whether it be with a group. Right now we can't do it with a group, but groups, individuals, maybe we'll do tele cooking classes. So we want to make sure people have the tools so they know, they know the right thing to do and they know how to do it.
All right, great. What's the name of that center going to be called? I know it's in Fort Myers, Florida.
It's called the Vibrant Beat.
Okay.
That's my card there, and information on the back for anyone who like it. But as I mentioned, we do telehealth consults. So for anyone that's interested, they don't have to live in Fort Myers. I'm happy to speak with anyone. So we have a great portal that's it's been very easy to use for both the patients and myself. So.
Okay, perfect. Well, I envision this as the future of medicine, the way things are going. Like you said, you're getting involved in their life rather than seeing them every here and there in the office, right? You're actually getting involved in their life. You're encouraging them. You're teaching folks what you know about how lifestyle can positively impact their health. And that, I hope, is the future of medicine. And I'm very thankful that you are taking the time and energy to put this center together. So, we'll do some more videos in the future too when it opens, because I know it's not officially open yet, at least not the physical building, even though you can do teleconsults.
Correct.
So
a couple months left.
A couple months. Okay, so we'll do some more. We'll touch base again. We'll do another video and we'll see what you've got going on there, because I know everyone's going to be interested to see that.
Awesome. I'm excited.
Okay, well, thanks so much for taking the time for this interview, and stay healthy and stay well, and please continue to do the great work you're doing with encouraging your patients with